Let's take you to Quebec City, where officials are providing a COVID update there.
À tous les Québécois. Une année difficile, bien sûr, une année qu'on entreprend dans une tempête, mais une année qu'on veut placer sous le signe de la résilience ensemble. C'est important aujourd'hui de faire le point suite à l'annonce de la semaine dernière, annonce qui a annoncé présenté le report de la rentrée en présence.
Where we reported on the return to school. So we'll have to talk about what has been implemented for the return for school in January 17 to ensure everyone's safety and security. It's very difficult. The variant is extremely contagious. However, with the work we're doing, with the equipment that we're installing and that we will install, with precautions that are taken, it's important to mention that our schools will be safe. Before anything else, it's important to see the pathway we've taken since March 2020. We have still come very far. Yes, things are difficult now with remote learning. What we couldn't do at the beginning of the pandemic in March 2020, we weren't ready. But today we are. We have done a spectacular advance thanks to equipment that we've more than quadrupled and giving internet access to those who didn't have it, teachers trained together with the counselors. And all of this is thanks to the dedication and professionalism of teachers of all school groups. It's important to mention. So now we can turn to remote learning, but are we satisfied with it? No. It's a good plan B. Our plan A is open schools and returning students and staff. So today, I want to mention several subjects: rapid tests, PCRs, masks, remote learning and return to school, daycares, report cards, exams, and of course, quality of education. So the rapid tests, I'm announcing today that as of the return of school on January 17, we will distribute to our students in primary school and preschool more than 3.6 million. We are restarting the operation we started in December by giving each student a box of 5 self-tests for primary and secondary students. That's 3.6 million tests. And then we'll do it again in February. We will have given our families more than 7.2 million tests. I think it's important to mention this, that in the weeks to come, it'll be a big operation. I hope it goes well. I spoke this morning with the school authorities who are ready to give us a big hand with this distribution project. So when a child has symptoms, he should be tested before sending him to school. And you don't send a child to school with symptoms. It's important to mention that the rapid tests facilitate life for all. It contributes mostly to preventing the spread and outbreaks in schools, and so it helps us to keep the schools open. Before? No, Christmas. We had also, from the end of September, we had started using rapid tests in school for students who are manifesting symptoms during the school day. We will continue to do this. It's important to send the message to parents that we do not send a symptomatic child to school figuring he'll be tested at school. You test him at home. But when symptoms come up throughout the day, it's good to be able to do rapid tests. About tests. At this time, teachers who are short of staff, they're not on the priority list for PCR testing, but they will be very soon. As of Saturday, January 15, members of the school staff will be able to use PCR tests as essential workers. Now, for masks. For the return, we'll continue to wear our masks at all times in schools. So in the school buses, common areas,
bonification importante.
during meal
C'est que
times.
nous aurons
An
davantage
important
de ces
point
masques-là,
is that we'll have
parce que
more of
on
those
a appris au
masks
fil du temps que lorsqu'ils devenaient
because
humides,
we've learned
parce
that
que
when
l'enfant,
masks become get
chaud, ou il postille
damp
davantage,
because
ou il y a
of
trop
they're
d'éducation
hot
physique,
or
ces
because of
tests-là sont
phys ed
beaucoup moins
class,
efficaces.
but they
Donc, on
become
sera
much
capable
less
de ne plus se
efficient.
limiter à 2 masques
So
par
we'll
jour
no
dans
longer
une
be
heure.
limited to
Les
2
élèves
masks
qui
per
en
day
auront
as
besoin d'un
needed.
troisième
Students
ou
who
d'un
need a
quatrième
third or even a fourth
pourront se
mask,
personnel
same
pourront
for the
se sentir meilleurs
staff,
parce
we'll be
qu'ils
able to
seront
get them
mieux équipés
because we'll be
et
better
auront ces
equipped.
nouvelles informations-là. Donc, c'est un facteur
So
de
this is new
protection
information.
supplémentaire.
It's an additional
J'ai
layer of
parlé des
protection.
masques, les masques bleus, les masques
I
de
talked about the
procédure.
blue
On
masks,
a
the
vu
surgery
plusieurs
masks.
demandes de masques 95, N95.
We've seen a lot of
Je sais que les
N95
enseignants en ont
masks. I
demandé,
know
les
teachers
syndicats
ask for
en
it.
ont parlé.
The union mentioned
On s'est
it.
retourné vers,
So we
les
turned
autorités
to the experts and
de la santé
authorities
publique.
in public
Il semble
health.
qu'à la CNSST,
And it seems that
et à la santé publique, on a
in
jugé
public
pas
health,
opportun. Dans ce cadre-là, le docteur Horacio pourra sans doute tout à l'heure
said it was not necessary, and this will be explained later with explanations about
le
this.
report de la rentrée.
Now,
Et
to
l'enseignement
the postponement of the return to school
La
and remote
rentrée,
learning.
elle est prévue pour lundi, le 17 janvier.
Monday,
En
January
présence.
17, is back to school in
Les
person.
écoles sont fermées, mais
So the schools are closed,
le
but
réseau, lui, il
the
est
network
mobilisé. Au moment où on
is
se parle,
mobilized. As
les
we
gens
speak,
sont au travail.
people are at
Il y a
work.
des cours qui se donnent.
Classes are
Les
being
services
given.
éducatifs, eux,
Education
ne sont pas
services
suspendus.
are
Avant
not
la
suspended
rentrée du 17, on suit
before they
l'autorité,
return the
mais c'est très
17th.
important
We
de
know
mentionner.
that this is very
Pour les
important.
personnes qui fréquentent les
For
centres de
those
formation générale aux adultes,
Who go to adult education, we're also doing remote
pour les gens
learning.
qui fréquentent les
For
centres de
those
formation, formation professionnelle,
Are going
on
to
fait
professional
aussi
training.
l'enseignement à distance.
It's also
Et
remote
dans ce
learning.
cas-là, parfois, c'est plus
And in
difficile
that case,
parce qu'on
sometimes
doit
it's more difficult
manipuler des choses,
because things
utiliser,
have to be
des
rearranged. We have to use
Dans ces cas-là,
tools.
quand on doit être
In those
en
cases,
atelier,
when we need to
en
be in a
laboratoire,
workshop or in a
il y a
lab,
des exceptions qui permettent
there are
de faire
exceptions that
l'enseignement en
allow
présence, ensemble.
in-person
Les
learning
précautions
with all the
sanitaires
precautions that are
nécessaires,
needed.
les laboratoires, les ateliers,
So for labs and
les
workshops
évaluations
and
qui
evaluations
peuvent
that sometimes require personal
peuvent se rendre en centre de
contact,
formation, c'est important
it's
de
possible to go to the training centers.
Lorsqu'on fait l'enseignement à distance,
When
au 17
remote,
janvier,
with remote
les
learning
règles sont
until
importantes, sont bien
January
connues.
17th.
Je veux simplement les expliciter.
I just want to
Pour les
repeat,
secondaires, bien,
for a
c'est
secondary
on
student,
suit l'horaire régulier.
we'll follow the regular schedule.
Supposons demain matin,
So
en
for
commençant
a student
en
would
mathématiques,
start tomorrow morning in math and then French and history.
en suivant l'horaire.
They will have them online by following the schedule. For preschool and primary,
Il y a déjà 18 mois, en fait,
we,
à partir de septembre 2020,
since September 2020, we want equality and cohesion within the network. For example, in 5th and 6th grade, we're talking about a standard of 13 direct teaching hours, but also 7.5 hours of homework. And student and teachers also have periods of availability where students can access their teacher for personal support. Additional services. The hand up we give some students will continue with that, with remote teaching. So students with special needs, if they need remedial teaching and so on, that will continue. They will get their services, even online. Now, a word on the adjustments we had to make for report cards and ministerial exams. Some students had ministerial exams planned in January, and they've been postponed by a few weeks. They will be held the week of January 24th and January 31st. For teachers and students and parents, there's a postponement of 2 weeks. Same for the report cards. That will be distributed quickly in January, but we're giving a 2-week grace period to allow the first report card to be handed during the February 11. So this postponement is good for everyone. Now, for daycare in schools, The first thing to do is to be aware that when schools are closed with remote learning, it is demanding on everyone, on teaching staff, and for families and employers. So we want to thank parents and employers for their understanding and collaboration. Times are hard. We have to take special measures. Remote learning is not perfect. And I know some parents who, when there's remote learning, they work from home. So I understand these situations. And daycare services are given in priority for essential workers, including healthcare workers, teachers, and other essential workers that are listed on the government website. Exceptionally, we can accommodate a parent who is not an essential worker. Their children can come to daycare. It's important to mention that daycare services are prioritized for essential workers. Now, on air quality. We are collaborating with the engineers who are responsible for our schools, but we rely on expert opinion on questions of health. So we are counting on public health and their team and research institutes of health at work and so on. It's important to mention. The school network, and we've talked to leaders and managers, the school network brings a very big importance to the health and safety of employees and students. In any case, the directives for air quality have been sent, the minister himself, myself, in July 2020. And since then, we've multiplied investments and efforts and directives to always move forward and better protect the health of students and staff. I'm happy to mention that by Friday, or 48 hours, there will be more than 50,000 CO2 meters that will be delivered in our schools. So 54% of meters that have been previously ordered, 50,000 delivered. But even more encouraging is that all the meters that were to be sent to schools and classrooms that were prioritized will be not only delivered, but installed and functional. We're talking about 10% of classrooms or schools which, following previous tests, those classrooms, those schools, will be duly equipped, and all of the others too, because we want to be sure to protect everyone. So CO2 meters, even to those classrooms whose test results that were completely reassuring. So that's an excellent piece of news. This morning I talked about the authorities in the schools. Everyone is mobilized. And no one wants CO2 meters in boxes. We want them to be installed without delay in time for January 17th. And I have faith it'll be done. We're the first in Canada to take that. We saw earlier France, the Minister of Education there, was asking for CO2 meters for the same reasons as we did. But ventilation is not just stirring up air. It's to aerate. And aerating in schools, we have to use mechanical systems. Open windows and install air exchangers. And we should mention that the ministry continues to distribute air exchangers. We've sent several hundred already, and others are available. If school centers make a request, the ministry will supply more. Now for technical questions of aerosol and so on. These are technical and engineering questions. Next week, for reporters, there will be a meeting with experts from the various institutions that can answer all your questions. So you will very quickly receive an invite to this presser. So what we're seeing is back to school that's special, is the beginning of particularities that are very demanding. And once again, we have to adapt and adjust. And it's important to say, my deputies team, my cabinet, myself, we've had many meetings with our partners in the network to adjust the actions we will take when we have to make changes and modifications due to the pandemic and Omicron. So I really want to thank all the people in the school systems and school boards, the managers, associations, general management, unions, parent committees, for their cooperation, which has been very precious to us since the beginning of the pandemic. And you are always present when we call you in, even weekends and evenings. Thank you. And I want to thank those who work in our schools. I know those people don't count the hours they're working. And I think all of Quebec is grateful for the work within the school networks. We can be very, very proud when we compare with other networks have done. A few reminders in closing. We have measures in place that are important for the safety, but we also have things in place for school success. If your child needs help, we have exceptional partners. We've invested additional money. They have more resources to support parents and children. I'm talking about our young people. And mental health also. Do not hesitate. On the national tutoring program in Canada that continues, and we can count on it, so we can be proud. A message to staff. You are considered priority for vaccination campaigns. I know some teachers have made appointments for a third dose, but they found their appointment was far. So if you have Click Santé, you can find another appointment and bring it forward. So a message to teachers and school staff, it's possible for you. Message to parents. If your child has not had both doses, please, I think it's important to have a conversation at home for your child to be vaccinated. If you have a child 5 to 11, it's a decision that is yours. It's important, but I think it's a wise decision to vaccinate your child. It protects the child and his friends, the family, and our healthcare system, and we need it. We all. I'm talking about all the measures, not just vaccination, to protect our neighbors and friends and healthcare system. We all have actions to take to end the pandemic and take care of one another. I would hope that in 2022 we're responsible and careful. Thank you.